You're live on Joy News today with me, Daniel Dazi. We're going to stay a few more minutes with the story of the vaccination rollout because we'll go to Kumasi immediately and speak to Himing Teria. Now, earlier on News Desk, Himing told us how in the 4 districts which have been earmarked for the vaccines to be rolled out in the Ashanti region, he's yet to see that the vaccination itself will begin. It was indeed reported that though some people queued in these districts where they were expected to see the vaccination done, that's the Kwabenya districts, the Kumasi Metro, Asokwa, and then the Oforiko municipality. Unfortunately, the Ghana Health Service officials said that they were yet to receive the doses from the regional headquarters. Ohiming has still been monitoring the situation in the Ashanti region, and he joins us with some more details. Ohiming, how has the situation changed, or is it still the same in the Ashanti region?
Thank you, Daniel. I must say, yes, the exercise has suffered some delays in the Ashanti region, with the 4 centers or 4 districts undergoing this particular exercise. Some districts have still not started with the exercise. When I spoke to some of the health officials, the message I picked from them was that they received information late today, and then the vaccines also arrived late. And that is how come they are unable to start on time. But I can report that in some of the facilities that I've visited, for instance, the Children's Hospital at KMA, and then the Suntreso Government Hospital and County Hospital at Abrepo, all under KMA, have started with the vaccination exercise. Here at the Menchia Government Hospital, I must say the health personnel are undergoing training on the new Johnson Johnson vaccine. So very soon they will start rolling with the exercise. And even at the center where the vaccination center where the exercise will take place, people have queued waiting to be vaccinated here at Menchia Government Hospital. Let me see if I can speak to the public health officer to find out. Public health nurse, thanks for the opportunity to speak to us. How is the situation at the Menchia Government Hospital?
The situation here is cool. Good afternoon to all listeners. We are starting today for the 3rd phase of the COVID vaccine. And for 1 or 2 challenges, we are yet to start over here. Training has already gone on. We've done our training, and in a few minutes' time, we are starting at Menchia Government Hospital.
Is it not surprising to see that though the exercise is yet to start, but we have people who are anxiously waiting in the queue to be served?
Yes, it is. It tells how people want the vaccine. They want to be vaccinated because of the nature of the COVID virus and how it's been changing itself. Nobody can tell for now what will happen in future. And so for now, I think everyone wants to be vaccinated. And so with a little information that we have vaccines, people are rushing to be vaccinated. Even before the vaccine came in, people were calling to ask when the next batch will be in. So people are anxiously waiting for them to be vaccinated.
Yeah, you talk about some challenges that you faced. What are some of these challenges that you mentioned?
Yeah, you know, after vaccination, records has to be taken, and we have tablets that your information has to go on. So far, those that we've vaccinated, we have all their information on our tablets. So it can be viewed worldwide. Yeah, so that takes a lot of time, and for the tablets to be ready for us to be able to even queue in the information takes some time. We have to do some logging in, password and all that. And so that has delayed a bit, and we'll soon be able to start.
In some of the centers that I visited, there were concerns with the fact that the vaccines arrived late from Accra. Did you have a similar experience here?
Yes, it's the same everywhere, but I will not say it arrived late. It was supposed to arrive today, and it did arrive early in the morning. It was in Kumasi. But the plan is that we are supposed to start as soon as the vaccine arrives. And so even if it arrives in the afternoon, you are supposed to start that afternoon. Yes, so we were supposed to get ready, and as soon as the vaccine arrives, we kickstart. So that is the plan. So I wouldn't really say that it has delayed.
What's your name and your position here?
I'm the public health nurse in charge of Menchia Public Health Department, and my name is Linda Ejakupoku.
All right, Daniel, that has been Madam Linda Ejakupoku, the public health nurse from Menchia Government Hospital, giving us some information on the exercise. And I must say, this is a center for the vaccination exercise under KMA. And here, a lot of people have already queued, waiting to be served as far as the vaccination exercise is concerned. We'll continue with our visit to some of the centers designated for this particular exercise, Daniel.
From some of these persons who have queued, and if you've spoken to them, how are they feeling with the delays and what's their reaction?
The people or the participants, they are not worried, they are not concerned so much with the delay because they understand what it takes for the whole exercise to kickstart. They've been receiving some information, some briefing at these centers where the exercise is currently ongoing. So they want to be vaccinated at all costs. So they are not perturbed. As far as they will be vaccinated, they want to wait in the queue. Once the health officials come around to give them information as to what has caused the delay, they are okay. I've spoken to some of them, and they've indicated that no matter what it takes to be part of this exercise, they will continue to take part because of the dangers associated with the COVID-19 pandemic.
Thank you very much, Ohiming Terry, for joining us from the Ashanti region.